Hi, my name is Carlos Cesar Cedeño Barreto. I to talk about T-cell transfer therapy targeting mutant KRAS in cancer. Introduction. Target therapy is a treatment for the use drug, however, is different from traditional chemotherapy. Drugs now as targeted therapy help stop the growth and spread of cancer. They detect a specific protein or genes. This gene and this protein are found in cancer cells or in cells related to the growth of cancer, such as a cell or blood vessels. Drugs can do the following: block or disable signal that the tells cancer cell to grow and divide, prevent cells from living lower than normal, kill the cancer cells.
Produced with exclusive support
grow and divide. But when cells
from Bavarian Nordic and Dendrion.
Uncontrollably, they become cancerous. There are more than 200 different types of cancer, and scientists are
Throughout our lives, the cells in our body grow and divide. But when cells start dividing and spreading uncontrollably, they become cancerous. There are more than 200 different types of cancer, and scientists are continually developing and testing new ways to treat them. Most cancer therapies involve drugs designed to kill the rapidly dividing cells. This is what chemotherapy does. But there is a different approach called immunotherapy. Immunotherapy uses the body's own immune system to fight cancer. This involves activating immune cells and getting them to recognize the cancer tissue as different from normal body cells. This isn't easy, but recently the field has had some success. The FDA has approved several new drugs, and with more drugs in clinical trials, some say we are entering a new era of anti-cancer immunotherapy. The idea goes back to the late 19th century, to an American surgeon named William Coley. He injected bacteria into tumours and watched them shrink. The bacteria, it seemed, were provoking an immune response. But our immune system is highly complex, and for most of the 20th century, scientists struggled to turn Coley's observations into effective cancer treatments. But after decades of learning about the immune system, a variety of immunotherapies are finally making their way to the clinic. We can divide them into 4 general strategies: non-specific immune stimulation, adoptive cell transfer, immune checkpoint blockade, and vaccination strategies. The first, non-specific immune stimulation, is used to give a general boost to the immune system in vivo. To do this, some of the many cells that make up the immune system, such as these antigen-presenting cells, need to be activated. Researchers can do this by injecting molecules that bind to receptors in the cell membrane. The activated cells then alert other immune cells, such as these T cells. T cells are the main players in the fight against cancer. When activated, they can attack and kill tumour cells. For full activation, small cell signalling molecules called cytokines are needed. 2 cytokines, interferon alpha and interleukin-2, have been developed as drugs and approved for use against some forms of cancer, including melanoma. Another way to stimulate immune cells in vivo is to inject bacteria, like William Coley did. This has led to a rather surprising use of the BCG vaccine. BCG is normally given to children as protection against tuberculosis, but scientists have found that the weakened bacteria in the vaccine can also help patients with bladder cancer. The bacteria appear to cause inflammation, which increases the number of immune cells around the cancer, helping them to home in on their target. Non-specific immunity can also be
used for cell therapy in the culture from a film pattern age 15
achieved by removing so-called immune checkpoint blockades. These blockades normally dampen down the immune response to prevent collateral damage to healthy tissue. But to fight cancer, scientists need to remove some of these blockades to make the immune response stronger. The antibody ipilimumab
75% CD8 T cells that we reacting to mutant KRAS G12D. This is observed in this video, in the before video. The woman one of 12 pattern or 3 good prospect identify T cell targeting personal mutate neoantigen, but the only one which cell therapy induced in enriquished population of T cells subsequently experienced tumor regression in all even like metastasis. Also, research observed CDH plus T cell reactivation against mutant KRAS in another patient with metastatic colon cancer. There was no response to cell therapy in this case, possible because only 0.002% of the infused cell target KRAS G12D. The pattern who did respond had this side progression in one lesion 90 months later, like due to the loss of the chromosome chip aploid that is needed for direct tumor recognition by the transferred KRAS G12D specific T cell. A continuation next you have to see one video to talk about T cells.
Your body's own immune cells are some of the greatest weapons you have against cancer. Adoptive cell therapy is a type of immunotherapy that uses your own cells. In one approach, cancer-fighting immune cells, called T cells, are removed from the patient, grown in the lab, and then given back to the patient in vastly increased numbers. As cells may be given, an army of T cells goes to work finding and attacking the cancer. Some types of advanced melanoma have been cured with this form of immunotherapy. A related approach, chimeric, means two different things joined together. In this case, an immune molecule called an antibody is joined to a T cell receptor. CARs turn your ordinary T cells into an elite fighting force that can seek out and
your body's own
cancer.
Immune cells are some of the greatest weapons you have against cancer.
The results are impressive. In some studies, 90% of leukemia patients treated this way have had complete responses.
Adoptive cell therapy is a type of immunotherapy that uses your own cells.
Being
In one approach, cancer-fighting immune cells, called T cells, are removed from the patient, grown in the lab, and then given back to the patient in vastly increased numbers. As many as 100 billion cells may be given this way. Once inside the body, this army of T cells goes to work finding and attacking the cancer. Some types of cancer, such as advanced melanoma, have been cured with this form of immunotherapy. A related approach is called CAR T-cell therapy. CAR stands for chimeric antigen receptor. Chimeric means two different things joined together. In this case, an immune molecule called an antibody is joined to a T-cell receptor. CARs turn your ordinary T-cells into an elite fighting force that can seek out and destroy cancer. Although the total number of people treated with CAR T-cells is small, the results are impressive. In some studies, 90% of leukemia patients treated this way have had complete responses. This approach is not yet FDA approved, but it is being actively pursued in clinical trials, and the technology is advancing rapidly. Created by the Cancer Research Institute, the leader in immunotherapy. To learn more,
Okay, in this video is to talk about chimeric antigen receptor. Is the name is CAR. This is an artificial super cancer fit machine, and today I'm going to tell you a tour of my life. However, this is one problem. Everything in my world is very small and it's impossible to see without a microscope. But don't worry, I have a magic dog even better. Just stick right through. Here in the body, all the cells start and T cells which around the body harmful. These T cells have two main types helper T cells are the pullotoxin T cells are the effective to immune system. They kill anything that gives you fun on the body. But there is one that and age of